As the Executive Secretary of Nigerian Investment Promotion Commission, in the work that we do at the Commission, we had noticed a big gap in the incentives that exist in Nigeria for the healthcare sector. We will continue the work that we're doing with the Ministry of Health to make it happen. But I think it is incredibly important that all governments, federal, state, and local government, support investors like Marcelle, Ruth, who have taken a big risk in bringing what is an impressive and laudable dream to life, but in the impact that this will have on the wellness and on the health of Nigerians. For me, the big impact is bigger than the jobs. It is bigger than the value of the investment. It is the improvement in the quality of lives of the Nigerians that will be treated in this facility. And the quality of that treatment is more than the machines and the quality of healthcare. Is the fact that they're surrounded by their family and their friends, by the sounds that they're familiar with, by the smells that they're familiar with, by the food that they're familiar with, which will help to greatly improve their recovery.
I would say that we're already seeing the huge impact that we have on the health sector since we opened, because we've only been opened about 7 months, and we've seen almost 500 new patients in that period of time. And clearly, for the majority of these patients, they will not ordinarily have been able to access the comprehensive diagnostic and treatment options for the cancers that they have, some already at a late stage. But in particular, with radiotherapy, where there are only 7 linear accelerators or radiotherapy machines actually in the country, when there should be 1 per 100,000 of the population. So as you can imagine, there's just not radiotherapy in the country. So that's one thing which we have brought, and we are seeing just a large number of patients being referred already from all over the country. So yes.
As humbled as I am impressed with what we've seen visiting the Marcelle Ruth Cancer Care and Specialist Hospital, I think it's not just the quality of the equipment and the quality of the care that patients will get here. For me, it's 2 things. One, it's a sense of you can be anywhere in the world. So I cannot imagine that anybody would go anywhere in the world and get better quality care. But there's also what I would call the home advantage, which I'm not sure that the center can properly evaluate. It's more an impact benefit. So it is the value of receiving the best quality care, the type you can get anywhere in the world, but you're close to family, you're close to the things you know, and healthcare specialists tell us that it is not just the quality of the care and the medicines that you take that play a vital role in recovery and doing well. It is also the emotional things that you attach to. So when I think of this investment, I think of it in more than, clearly a lot of money has been spent to bring this dream to life. But the impact of it is clearly a lot more than the amount that has been spent. It is the impact that this will have on improving the lives of Nigerians.